When people hear the word dementia, they often think it's just another name for Alzheimer's disease. But that's not true. Stick with me for a few minutes, because understanding the difference can make a huge difference for families, caregivers, and anyone trying to make sense of a loved one's diagnosis. Hi, I'm Dr. Harshi Paris. I have a PhD in the biological sciences, and I've spent years studying brain diseases, not as a headline reader, but as a scientist working behind the scenes, inside research labs and alongside biotech companies trying to find real treatments. My goal here is simple: to help you make sense of complex brain diseases like Alzheimer's based on real science and real research and real clinical trials, not just Google headlines or surface-level answers. I'll break down how this disease really works, from what happens inside the brain and the genes that raise the risk, to the tests doctors use, the treatments we have, and the new research bringing hope for better answers. I want to give you clear facts, not fear, so you can truly understand what's happening inside the brain, what actually works, and what doesn't, and maybe even how to protect yourself or a loved one based on scientific facts. Today we're going to clear up this confusion with 3 clear sections so you'll understand exactly what dementia really is, what leads to dementia, and why knowing the difference matters so much. Let's begin. Many people think dementia and Alzheimer's are the same thing. But here's the truth. Dementia is actually an umbrella term. It describes a group of symptoms like memory loss, confusion, and changes in thinking or behavior. Alzheimer's disease is the most common cause of dementia, but there are several other diseases that cause dementia. For example, Parkinson's disease, Huntington's disease, including vascular dementia, Lewy body dementia, and frontotemporal dementia, and even AIDS and syphilis diseases. To put it simply, all Alzheimer's is dementia, but not all dementia is Alzheimer's. Dementia itself isn't a single disease, but a syndrome, meaning it's a collection of symptoms that seriously affect a person's memory, reasoning, behavior, or ability to carry out everyday tasks. A person with dementia might forget recent events or conversations, struggle to follow simple instructions, get confused about time or place, have trouble finding words or understanding language, experience changes in mood, personality, or judgment. For a doctor to diagnose dementia, these symptoms have to be severe enough to impact daily life and independence. So remember, when someone says dementia, it's not a specific diagnosis by itself. It's a description of what's happening in the brain. To truly help someone, we need to figure out the underlying cause. Next, let's talk about what diseases cause dementia. There are many causes, and here are the most common diseases responsible for dementia. Alzheimer's disease. Alzheimer's disease is the most common cause, responsible for 60 to 80% of dementia cases. It's linked to abnormal protein buildup in the brain, amyloid plaques, and tau tangles that gradually destroy brain cells.
Vascular dementia.
The second most common cause. It occurs when blood flow to parts of the brain is blocked or reduced, often due to strokes, mini-strokes, or chronic high blood pressure. Lewy body dementia is caused by clumps of protein called Lewy body that disrupt brain signaling. This form often includes movement issues and vivid visual hallucinations.
Frontotemporal dementia.
This affects the brain's front and side regions, often causing major changes in personality, behavior, and judgment, sometimes before memory problems even begin. Parkinson's disease, dementia. Some people with Parkinson's develop dementia symptoms as the disease progresses. Huntington's disease. Huntington's disease is an inherited disorder that slowly damages brain cells, leading to dementia symptoms like memory loss, poor thinking behavior changes, and movement difficulties. Mixed dementia. Many older adults actually have more than one cause at the same time. For example, Alzheimer's plus vascular damage. This combination can worsen symptoms. Brain infections, untreated HIV or advanced syphilis can also cause dementia. These are rare today because of medical advances. There are other less common causes of dementia as well. So as you can see, dementia can actually be caused by a whole range of diseases, not just one. It's a symptom caused by many different diseases, each with its own pathway and progression. Let's now explore why identifying the cause of dementia is so important and how it can change everything. Many families hear the word dementia and assume that's all they need to know, but to truly care for someone, we need to understand what's causing it. Different types of dementia can look and act very differently. Someone with vascular dementia may decline in steps, especially after mini strokes. Someone with Lewy body dementia might experience vivid hallucinations or act out dreams. Someone with frontotemporal dementia may lose their filter and behave in unexpected ways. Each form of dementia requires its own approach to treatment and care. Some medications can help with Alzheimer's, but don't work for other types. Managing stroke risk is essential for vascular dementia. And in some cases, like normal pressure hydrocephalus, symptoms may even improve with surgery. Some causes of dementia are reversible or manageable if caught early, which is why pushing for a specific diagnosis matters so much. It's not just about naming the disease. It's about unlocking the most effective support, care, and hope for each person. So to summarize, the key takeaways are: dementia is an umbrella term for serious decline in memory and thinking. Alzheimer's is the most common cause, but not the only one. An accurate diagnosis leads to better treatment, care, and support. A dementia diagnosis can feel overwhelming, but knowing the type can change everything, turning fear into understanding and opening the door to tailored care. No two journeys are the same, and every person deserves support that fits their condition, not just a one-size-fits-all label. Remember, dementia doesn't define a person. Clarity, care, and compassion do. If you or someone you love is facing dementia, ask what kind. Push for clarity. The more we understand the cause, the better we can treat and even prevent some forms. Dementia is not one disease, and there is hope. If this helped, please share it. You never know who might need to hear. Thank you for watching, and see you in the next one.